Hi, everyone. I'm Brooke McKeever, and I am thrilled to be here with you all from the HKConferences. So thank you so much for the invite, Dr. Rastafa Geddes and the Geddes Neural Network. I greatly appreciate being here with you all, and I'd love to answer any questions that you may have as well. And let's dive into photobiomodulation of the brain. Brain health, transcranial photobiomodulation, or tPBM. This presentation is by myself and LightMD, which is a division of Applied Biophotonics, a worldwide company. Cognitive disorders encompass a broad spectrum of neurological deficits. This includes Alzheimer's and dementia or memory-related diseases, mild cognitive impairment, early onset dementia, frontotemporal dementia, Lewy body dementia, stroke-related cognitive dysfunction, or we have TBI, mTBI, concussions, neurological diseases such as MS and Parkinson's. So we'll start with where in the brain and the functions. In the frontal lobe, we have the cognition and motor skills. Parietal is perception. Temporal lobes, memory and audio. Occipital is vision. Hindbrain, memory and motor as well. In the brainstem, we've got the autonomic nervous system, metabolism, as well as the connection with the spinal cord from the brain to the spine, so your central nervous system. We've got the ganglia, which with interneural communication, and the corpus callosum with the left and right brain communication. Now, for the pathology, we can have motor dysfunction, cognitive disorders, metabolic dysfunction, or endocrine dysfunction. And these can come from etiologies such as mTBI, concussion, strokes, hypoxia, or hypoxemia, pathogenic infections that can happen in the brain, metabolic dysfunction, allergies, toxins, or even congenital defects. Some comorbidities can lead to these neuropathies in the brain, such as hypertension, diabetes, arteriosclerosis, inflammation, autoimmunity, and genetic factors. Today's cognitive health challenge is that few modalities treat brain neuropathies. There is an option for surgery or pharmaceuticals, but they're just not good, viable options, and we haven't found cures for these or anything really to prevent and to dramatically slow down the process. So neuropathic cognitive impairment is a pervasive and growing public health crisis. That includes Alzheimer's and dementia. We also have chronic traumatic encephalopathy, so CTE, brain fog and inflammation. The common brain neurological etiologies are the TBI. This occurs mostly from accidents or sports injuries. The type of different strokes that can occur are ischemic, hemorrhagic, or TIA. We've got also drugs toxicity, so overdoses with narcotics, also pharmaceutical addictions, age-related neurodegeneration diseases. Also affecting the brain is Lyme, herpes, and long COVID, as well as mitochondrial bioenergetic dysfunction. So there is a lack of therapeutic options, which is where we come in. So introducing LightMD's photobiomodulation. So photobiomodulation is the therapeutic application of non-ionizing electromagnetic radiation in the near infrared and visible light spectrum applied to living cells, which invokes a metabolic and gene expression mechanisms to combat disease, injury, and pain. On your screen here, you'll see what the LightMD Mark II PBM system looks like. It can fit in a shoebox or a backpack. It can be carried with you. It can be used in hospitals. It is hospital grade materials. You'll see Light Doctor, that's our sister company from Applied Biophotonics that operates in Asia. This is a professional product used by professionals, hospitals, doctors, but also consumers. It is medical grade quality, hospital safe, FCC certified to not interfere with any other technology, radio waves, or anything implanted in the body. It's also IEC rated, eye safe. Now, there are a lot of light devices coming out, and this certification is imperative as a lot of the treatments are beauty treatments, plus over the brain, you often will have the light in your eyes. So it's important that this is eye safe. It's also FDA and GMP manufacturing approved. So we've been through multiple audits and have passed everything, some as long as 2-week audits. So we are free and clear with the FDA. This device and the therapeutic use of it is non-invasive. It is non-toxic. We are not adding any chemicals or needles or knives or anything in order to achieve the desired results. It's non-porous polymer materials in the pads, does not harbor bacteria like some of the rubber neoprene materials that you've seen. It is kidney and liver safe. So doing this treatment, you can't damage your organs or have negative side effects besides dehydration, which is very controllable. So it's completely safe to use and has been tried and tested since actually early 2000s. It is not a drug or pharmaceutical. And last but not least, it's very convenient and comfortable. It's easy to use, it's easy to operate, and the results are amazing. So we've got versatile software and precise photonic control of the photobiomodulation. So the Mark II PBM system has reconfigurable light pads. You can see these pads here. They're in 2 sets of 3, meaning that you can treat 2 areas of the body at once. You could do the brain and the gut, the brain and the heart, the brain and the spine, the brain and the lungs, or you could do the brain and a knee if you have knee pain. So it can literally, or you can do 2 brains at once. So it is quite user-friendly, and it is controlled with dynamic frequencies as well. You can control the duration of time. You can adjust the irradiance, so the brightness of the LEDs, which will ultimately affect the overall power. You can do a precise dose, which is the fluence. So this is a big thing right now, a big topic in the photobiomodulation industry is getting the precise doses. So a lot of studies are coming out with the need for dosing. This system allows you to control the dosing. So it's already way ahead of its time, and adding that in is we are prepared for the next stage. It's got algorithmic sessions. So they are sequenced and easy to use. Also a hierarchical software. Let's dive into the biophysical mechanisms of photobiomodulation. So we have light absorbing molecules called chromophores, which are in the mitochondria of our cells. The mitochondria is known as a little powerhouse or power plant of the cells. In these, the chromophores are cytochrome C oxidase, also nitric oxide. You have lipid protein, water homeostasis, and mast cells. You also have the transient receptor potential for calcium cation. So when the light hits the tissue, specifically in the cells and the mitochondria, this process, a photochemical process occurs. Okay, so the cytochrome C oxidase responds to the light, and it enhances the mitochondrial membrane potential and starts the process of ATP synthesis. So give me one second. So when we have this and we're affecting the transmission of the electrical transmission of electrical signals, you have nitric oxide release from the cell, allowing for fresh oxygenated blood into it. You have calcium cation modulation, and you also have nuclear transcription factors releasing. The physiology of this is that the vasodilation occurs. You have an increase of circulation. So now you have the blood vessels that have expanded. So more blood flow can go through, more circulation happening. The lymph system is doubled. The oxygen saturation is affected, often increased immediately or in minutes. You've got protein, hormone, and enzyme synthesis. leading to neurogenesis, angiogenesis, and fibroblastic activity. So all of this happening, I'll give you a timeline here in a moment. There we go, timeline of mechanisms of action. So neuromodulation happens first. That happens in the first 10 minutes. This can be through brain entrainment, usually on the frontal and temporal lobes with pulse frequencies in the low hertz range, coordinating to whatever brain state that you want to achieve. We also have neuromodulation through pain relief through the back of the brain. All this can occur in 10 minutes. In 20 minutes, you have the reactive oxygen species and nitric oxide generation. So those are released from the cell. This starts the process of the vasodilation and circulation. We have anti-infective frequencies too for innate immunology. After this process and the temperature of the tissue has increased, then in 6 to 8 hours is when the ATP is generated from the light energy. So ATP, adenosine triphosphate, is cellular energy, and that is increased with the MMP as well. And this is part of the molecular signaling, and increased metabolism occurs. Then in 24 to 36 hours, so basically the morning after, you have protein synthesis that begins and gene expression. You have the nuclear transcription factors, which is leading to the protein synthesis and the translation of the mRNA. Okay. And then that carries on from 24 to 36 hours. In the process of 1 to 3 weeks with continued sessions, that's not every day. It could be 2 times a week. It could be 3 to 5 times a week. It just depends on what we're working on. That's when the major process of inflammation and remodeling can occur. So major edema, you have inflammation and granulation, you have wound repair. Now, wound repair is a complex process. It is started immediately after the 24 hours with the light therapy, but to get that complex level of healing, it really is going to take 1 to 3 weeks. After that, we have greater than 3 weeks, we have homeostasis. The equilibrium is going to be reached. We have a healthy cell state and physiologic equilibrium. Now, this can take 3 months. It can take a year. It just depends on how far out of homeostasis that the individual that we're working with is. I can give you an example. We have a client in our clinic who was way out of whack, and the doctor, she's seeing about 4 different doctors, an oncologist, a rheumatologist, endocrinologist, and internal medicine, as well as naturopaths. These doctors thought that she would be better, gave her an estimation of 2 to 3 years. In 4 months, we got her to homeostasis. So it can happen a lot faster, and that is the goal, is to speed up the natural healing process for all injury, illness, and disease. So Mark II's transcranial photobiomodulation is unlike any other because, number one, we can treat a large area. So these pads can treat up to 1,200 centimeter squares. There's over 1,200 LEDs working on this to penetrate the surface of the skin and to provide this overall fluence and energy that's going to help you heal yourself. The pads are easy to place and forget. You don't have to hold them on. We usually have a wrap to hold them in place, or somebody is, or we have a mechanical arm if we don't want the pads to touch the brain. It can be positioned over affective lobes. So as you see on the bottom, we have the light ABP, the neck pad, which is called our cervical collar as well. It can go there around the neck, but it can also be used as a chin strap to get up into the pituitary, the pineal, the hypothalamus as well. You can use the 3 pads or 2 pads over the face, which will also cover the ears and the temporal lobes. You can go from the back of the neck, the back of the head. You can go to the top to cover the corpus callosum and down into the temporal lobes. You can even have it going from the frontal lobe to the back of the neck and the forehead. So you can treat the forehead with both the neck collar or the regular pad. So either way, we can cover all regions of the brain. The pads are flexible, so they bend to match the skull contours. This is super important because you want the light to hit the surface of the skin at right angles. So all of these pads can contain both red and near infrared light. It's important to have both. Near infrared light is the light that's going to penetrate the skull the most. Red light also is known to penetrate the skull, but just not as deep. Our system also uses pulsed frequencies, so controlling this is important. And there are sequence sessions. We have silicone covers to keep this hypoallergenic and to keep everybody's skin cells to themselves. And then it says also the neck pad for the brainstem and the vagus nerve. Does light penetrate the cranial skull? Yes. So just getting into this, we show that near infrared and red light penetrates the skull bone. This was a study done in 2012 in a cadaver. So you can see on how far that it's going to penetrate. I'd like to see with the new style of cadavers that Dr. Ross and his neural network are working with, which are pretty lifelike. It's fascinating. I'd like to see if this changes and to track the penetration. So that would be something fun to look at and to add to this research. So penetration depth depends on the wavelength. So that means the red or the near infrared in the 600 or the 800 range. The frontal skull in women and men and different ages and sizes varies. So that is a factor. Studies confirm both red and near infrared reach the brain. Majority of cognitive deficits involve the cerebral cortex injuries, so frontal lobe of the cerebrum. Cerebrum and cerebellum affect motor neurons and coordination. So you can see in the left parietal skull, the near infrared is this one with the 8.3%, whereas the red is 1.7. In the left parietal skull, another model had 9.7 and 4.4. Two models in the front had 4.4 and 7.4 versus 0.3 and 1.8. So as you can see, there's a lot more of the penetration of the near infrared light. So modalities of LightMD's transcranial photobiomodulation, we have figured out that by precisely controlling the irradiance, which is the power, the luminance, which is the energy, and the pulse frequency, the Mark II is able to target neurons non-invasively, delivering 3 distinct therapeutic modalities to the brain. Neurological repair with neurogenesis and tissue oxygenation, neuromodulation like analgesia and pain management, and brain entrainment through the front brain is the neural subnet syncing. So why does the frequency of PBM matter? The neuron repair is frequency dependent. Ion channels require time to transport charge. Nerve transduction is a process of transmitting electrical signals along the neurons. So it does have a maximum frequency. Neuron cannot re-trigger during the absolute refractory period. This is because it needs a break. It will not have enough energy. This happens all through action potentials, which are the rapid changes in the voltage across the neuron's membrane. So the maximum frequency, as you can see on this graph, it refers to how often the neuron can fire its action potentials. The neuron can't fire continuously without a break due to physiological limits. And then after an action potential occurs, the neuron goes through 2 of these refractory periods, the absolute and the relative. So during the absolute, it cannot fire another action potential no matter how strong the stimulus is. And this is because sodium channels are inactivated and they need time to reset. This ensures that action potentials only travel in one direction, and also that signals are distinct and don't merge together. So the absolute refractory period, you can think of it as a cool down phase for the neuron. Now, the neuron during the relative period can have a re-trigger, but it requires a much stronger stimulus. So it's temporarily hyperpolarized. There's a frequency dependence of photobiomodulation. So neurologically, it's a radiculopathy, and oxygenation, and neurogenesis. Those are all different frequencies from high to low. The EEG and brain waves. So providing the brainwave entrainment, you can have the low you can have like 1 hertz. So in delta, you can have theta, which is like 4 to 7 or 4 to 8 hertz. Then you have alpha, which is 8 hertz and up. And then you've got, I know, gamma into the 40 hertz range. So just depends on what you're working on, whether you want to induce sleep and go to delta. If you want to promote relaxation or meditation, you go to theta. If you want to improve cognition, you go to alpha, and to improve memory, you would go to gamma. So these are able to be entrained in the brain as EEG and brain waves. Other frequency dependents are neuromodulation. You can achieve analgesia and the pain relief, or homeostasis in the balance. So a wide range of frequencies with the LightMD system. You can go from 1 to 10,000 hertz that are already pre-programmed in, or 10,000 to 20,000 hertz, which can be customized and entered manually. We've got quite a bit of case studies for the Light Doctor, our sister company in Asia, Transcranial Photobiomodulation. We have some here in the US as well, but not quite as many there as are there, and they're doing them in hospitals as well. So for mTBI and concussions, a lot of those were done here with Dr. Joseph Leahy, who's a San Francisco 49ers team doctor. There's over 140 of those. We've also got major depressive syndrome, stroke, Alzheimer's, and dementia. There's 10 of those. Pathogenic infections like long COVID, brain fog, Lyme disease, and pandas. We've also got 4 studies for neurodegenerative diseases, Parkinson's, and lupus. So these case studies are profound and have led to us developing protocols as such. In the pictures, you'll see this is an excellent headband placement for the forebrain and hindbrain. This is a common treatment that we do for Alzheimer's and dementia. So for transcranial therapy of mTBI or concussion, we've treated over 145 mTBI patients. This is also, like I said, through Dr. Leahy and other clinicians. These can come from car collisions or mostly sports and football specifically, and soccer. Lots of women with soccer as well. The positive outcomes happen in 142 out of 145 cases. They did the transcranial PBM by LightMD, and you want to work on the area of injury, but also on the brainstem and ears. We have subjective assessments, so patients self-reporting as well as testimonials. There's also the doctors performing concussion evals, like the ACE test and the SCAT-5. The objective measurements were EEG through the NeuroSky, and the Leahy Concussive Index, which is the LCI. Now for EEG, we are exploring now the Neuro device, which you'll hear from Alvin about, or if you haven't already. So we're very excited to be testing that technology so that we can have more data points and can help our clients better. This is a young lady who had a concussion. She said, after receiving my first light session, it was like a complete 180. I was more of one myself. My energy increased. I was able to focus and remember a lot better. I was really impressed. So the LCI is a quantitative measure of concussion. That's Leahy Concussive Index, measuring its nonlinear signal processing, measuring Higuchi fractal dimension, the Shannon entropy, and the EEG scaling. I will go into more of this later, but because we're a little low on time, I'm going to go just pass through this. The LCI does confirm the tPBM of efficacy in our concussion therapy, though, so showing that the patients can go back down to baseline after the treatments. So that's very important. So we've got the brain swelling and trauma, the first session, and then additional sessions will get you further. So your LCI 0 to LCI 1, a change of about 16%. These are all patients, and these are the changes that they went through 0 and the first session. So transcranial photobiomodulation of depressive syndrome. This was done at a hospital in Taiwan. So treatment across the top of the head in the frontal and temporal lobe, reduced emotional symptoms while increasing tissue oxygenation. So you can see the negative symptom severity decreased here in the PANSS negative scale score. This is showing an increased area of oxygenation here. So here's before with poor circulation and oxygenation. This is afterwards, and this shows the changes. So really profound here. The other part of this study is showing the change in the increase of transhemispheric neural connectivity. So big changes here before and after transcranial PBM by LightMD. I have some additional case studies here as well. So, excuse me, we have an 80-year-old female with advanced Alzheimer's disease, unable to care for herself, recognize family, or comprehend her surroundings, made a full recovery in cognitive and motor skills in 8 weeks after commencing Light Doctor tPBM. She now plays mahjong without assistance. Our second one is a 93-year-old female living with Alzheimer's. She was living in 4 years in an assisted living memory care unit. This is one of my clients, unable to remember the many countries she traveled in her life. After 11 biweekly sessions, her neurologist noted that in her 20 years of practice, she was the first ever to improve enough to pass the dementia exam. So both the neurologist and the family of this client ended up purchasing our system. We have some Parkinson's case studies here, which are profound. We have a 69-year-old female with Parkinson's 1 year after diagnosis with mild but steadily increasing symptoms. She tried a 40-minute tPBM session. Later, 2 days later, following her only session, her shaking and other symptoms remarkably improved. She ended up purchasing because she lives in a rural area and was not able to reach a clinic for these treatments. So she and her husband are self-administering these sessions. And her daughter, who is a neuro nurse, has exclaimed how much this has benefited her family, especially her mother, and slowing the progression of the Parkinson's. Another interesting case from my clinic is a 64-year-old male with PSP. So that is a rapidly progressing supranuclear palsy form of Parkinson's. And it's a rare disorder causing which the medications, they do not respond to the normal Parkinson's medications, causes dysfunction in speech, movement, walking, balance, vision, swallowing, eye movement. His doctor had given him 6 to 8 months to live. After performing light sessions on him three days a week for 2 weeks, his wife said she had her husband back. He could talk to her on the phone. He could handle business calls. He could write. He felt normal. He was even golfing. And after 8 weeks of treatments, his doctor withdrew the prognosis of impending death, and he purchased a system, and he is still golfing today. We also have cases with pandas, which are phenomenal: aborted stroke, CVST stroke recovery, vaccine injury, and long COVID, a gunshot wound leading to CRPS, neuroendocrine failure as well. This is a stroke recovery case study. So after 1.5 year remaining unresponsive, paralyzed, and bedridden, the patient made a full cognitive and motor recovery in less than 8 weeks of light therapy. So it passed all of his tests, and it was a dramatic recovery. This was also done in the hospitals in Taiwan. So transcranial PBM offers an emerging non-invasive modality in the treatment of cognitive and motor impairment from stroke, trauma, and disease. Case studies confirm that tPBM, cognitive recovery of mTBI, depressive syndrome, stroke, and Alzheimer's, the biophysics of 3 transcranial PBM modalities and the frequency-based mechanisms are disclosed. High-frequency brain neuromodulation for analgesic relief from pain, neurological repair and neurogenesis via in TFs and enhanced oxygen and brain entrainment, enhancing gamma beta cognition. Like Norman Vincent Peale said, if you can change your thoughts, you can change your world. These are protocols that they only really apply to people who have systems. I'd be happy to go over those with you if you are interested. I also want to thank Richard Williams, Dan Shell Kinlan, Jeff McKeever, Dr. David Kahn, and Dr. Joseph Leahy for their contributions and cases contributing to this presentation. And the companies Applied Biophotonics, LightMD, Light Doctor, My Clinic Ultra Red Light in Newport Beach in Southern California, and Chase Chiropractic up in Northern California. And last but not least, let's keep in touch. You can find me on LinkedIn or email me directly, brookm@lightmd.com. You can find me on social media, Ultra Red Light, Instagram, Facebook, and YouTube. We at LightMD are interested in sales, research, both clinical and case studies, podcasts, corporate events, conferences. We are open for things. So let's dive in. Let's learn more about the brains and how photobiomodulation can affect not only the brain, but the whole body. And let's make a movement to help each other heal. Thank you again, everybody, for your time. And I love being here. I'm available to answer questions.